You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
Migraine headaches are severe headaches which often are associated with nausea, vomiting, aura. Normal headache, conventional headaches that are not really migraine, they usually do not cause nausea, vomiting, fear of lights, fear of sounds. And that's how the diagnosis of migraine headaches are made. There are two different reasons for classifications. There is a classification that our neurology colleagues have: episodic, chronic, and headaches that can cause paralysis, paralytic migraine headaches. That is one classification for their definition in terms of neurology. But we also have a classification in terms of surgical treatment, like a frontal migraine headache, meaning headaches that start from the forehead; occipital migraine headaches that start from the back of the head; temporal migraine headaches start from the temple. And the reason that we have our own classification is mainly the surgical treatment is going to be a little bit different. So we need to identify the trigger site before we operate, and the patients actually lead us to that conclusion as to where the headaches are starting from. When patients tell us we have migraine headaches, my first question is, where do they start from? Sometimes it is a little bit vague in the beginning, but with persistence, I can usually get the patients focus on where the headache is starting from. But there are some patients that actually, they walk to our office and say, my headaches start from here, from the top of the head. So I know anatomically where they're triggering from, so I can target the surgery and eliminate or deactivate that trigger site. Many of the migraine headache patients have headaches originating from behind the eyes. And those are the headaches that are originating essentially from the nose and the septum and turbinates. Inside the nose, we have a wall that is partitioned that's called the septum, and projections that come off the side wall of the nose. And when there's any contact between those two structures, can trigger headaches. There are the reasons that we don't need to get into. Okay, the headaches can originate from inside the nose. As far as the ear is concerned, the ear itself actually is not really a component of a headache, but there are vessels right in front of the ear that travel towards the top of the head, and those vessels can trigger headaches that start in the temple area, and that's the hair-bearing temple area, where we have another nerve down here between the eye and the sideburn, and that is the different type of temple headache, and the nerve that is involved in that process is a little bit different. So ear is not really an originator of the headache, but vessels in front of the ear can, and the nerves in front of the ear can start the headache.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.